As the flu season approaches in the United States, health experts are warning that the addition of another respiratory illness on top of the ongoing COVID-19 pandemic could overburden the healthcare system, strain testing capacity, and increase the risk of catching both COVID-19 and the flu at once. Welcome to Health Talks. I'm Laura Termini, creator of chickenall.com, and with me is Dr. Shukla, infectious disease specialist at the University of Miami Health System, and we are going to be talking about the flu shot because it's flu season. Hi, doctor. Welcome to Health Talks.
Hi, thank you for having me.
Well, we have a lot of questions about it, and when I was doing the questions for this interview, I got myself into this crazy thing in my head, like, oh my God, the flu season is coming. And even though I've been reading a lot about vaccines, and we've been having interviews and knowing about everything else, COVID-19 seems to be something that is, a lot right now, plus the flu season. So what are some of the key misconceptions that we read in here, or you read in here, your patients have about the flu shot?
Sure, I think there's a couple. One of them that we've had even before COVID, which is a lot of folks think that getting the flu shot will give you the flu. And it's simply not true because the vaccine is a dead virus. So basically it can give you the flu. Well, there's two things that can possibly happen. One, if you ask the patients, why do you feel like it gave you the flu when you took it last time? And when you ask them, they either say one of two things. Either they felt sort of uneasy for a day or two and then they were fine, or they said that they developed a cold type of symptoms like runny nose and cough and things like that. The first example is probably that they just had a mild they're just getting the vaccine, so their body was reacting and then it went away. The other is, that most people get the flu shot sort of later in the season when there's all kinds of respiratory viruses circulating that cause the cold. And so they get the vaccine and then they think that the symptoms they developed are related to the vaccine, but they were going to happen anyway because they were exposed to another virus. Because the symptoms of other cold viruses are much more mild, like sniffles and cough, compared to flu, which really makes you very sick and you're out for a few days. So that's how you know that didn't cause it. So when you kind of talk to patients about that, they understand a little bit and they're less reticent to get the vaccine.
I'm going to be sharing with you I ask my readers to share with me their questions and concerns about the flu shot and COVID, and receive some, thought-provoking responses because everybody's so confused. So I love your take on the following. Going to the doctor's office seems risky during COVID-19.
Yes, that's also a very common question. People don't feel comfortable going to the doctor's office. But for example, at the University of Miami, all of our clinics and hospitals, everyone wears masks. We clean very regularly all the high-touch areas. So we basically eliminate any COVID exposure possibilities at the moment you enter the building. And I think many of the other clinics and doctor's offices in the community as well have been doing these things. Even the dentist office are doing things like that now, and other, not even just clinical spaces, but even, the stores and things like that, they're doing that type of stuff as well to prevent transmission. So I think it's very safe to go to the doctor's office, and it's certainly the right time to go to get your flu shot.
I'm already social distancing and wearing a mask, so I won't catch the flu.
So that's a good point. You should continue to do those things, but unfortunately, you still get exposed because most people take the mask off when they go home with their immediate household members. And even though we all try to be safe all the time, we don't know at what points in the day our family member or someone else may have not had their mask or may have gotten exposed, because you can get exposed to the flu the same way you get exposed to COVID-19, which is through the respiratory tract. And so you don't know what the other person, at least in your family members, even if you're good about your mask all the time, there's no guarantee that your family members who you get exposed to at the end of the day, what they've been exposed to. And so I think it's still very important to get the flu vaccine.
The flu vaccine isn't very effective anyway.
So also another good question. I mean, these are all very, very well thought out questions. I think that the reason people feel that way is because people still come down with the flu every year. And the truth is the vaccine is not 100% efficacious, but it is, depending on which season you look at, up to 60% efficacious. And that's important because even if you can have 60% of people who are immune from the flu that season, you're preventing transmission, which is, I think a lot of folks have heard a lot more about transmission because of COVID, but the same principles apply for the flu. Is if you are able to get some people, and 60% is a large number, protected, then it stops the transmission. That person won't pass it on to someone else. And the other thing the statistics might not say, and we don't know necessarily, is how many people get sort of an attenuated response. In other words, how many people get the flu, but it's not that, it's much more mild because they got the vaccine. And that's another whole set of people that benefit. So it's not just that, it's also that if you get the vaccine, there is some evidence that you'll have a less severe illness. And then the other point, which is probably the most important, is that the people around you, your family members and others who are immunocompromised, meaning they are elderly or they have a condition and they take medications that suppress their immune system, that are very vulnerable to any of these viral diseases, you're also helping protect them. So not just for you, but also for those around you. It's good.
Talking about family, my parents got the flu shot back in February. Should they do it again now, or they have to wait a year?
They should do it again because the flu season is basically based on winter months.
Okay.
And so every year they relook at which virus was circulating in the community in the prior year. And also, they look at data from the viruses circulating in the Southern Hemisphere, because remember the Southern Hemisphere has their flu season in the summer months because the weather is the seasons are opposite to the Northern Hemisphere. So they look at all that and they decide which they think will be the most common strains, and that's what they base the flu vaccine on. And that's updated every year. So it's important to get it during the fall months.
One of the key misconceptions that I hear is I'm young and healthy, so the flu isn't dangerous for me.
So again, if you're young and healthy, and that's great, and I would imagine even if you unfortunately got the flu, you probably would make it through, although you would be miserable. Even young and healthy people are sick for several days and they can't work, and it's a very miserable situation when you actually have the flu. But again, young and healthy people are also around other people who are immunocompromised, who may still be young. They may have, a disease that causes their immune system to not be normal. And so you're putting them, who may be your friends or family members, at risk. And also the elderly that you may interact with. And the other population that is affected by the flu is pregnant women who can do poorly if they get the flu. So again, if you have friends who are in any of those situations, then it's good for you to provide that protection, not just for yourself, but also for them.
The vaccine contains harmful chemicals and can cause disease, something that it was pretty much created on a social media movement, and then people started to realize that it wasn't a correlation. So what's your take on this, doctor?
So there's a lot of concern about the ingredients of the vaccine, and I think that the CDC, for example, has acknowledged that, and they actually put all of the information about every single ingredient on their website. You can actually access it on their website, and the ingredients are primarily the actual vaccine, of course, but then the other things that need to go in it, a small amount of antibiotic, a small amount of preservative, and things like that to protect you further, as well as to protect the medication from going bad, from being in a shelf. So it's very, very small amounts, and there hasn't been anything that has been linked to any poor outcomes related to any of the ingredients in the vaccine. So they're perfectly safe, and I think that the CDC has been very transparent about what types of things are in there in terms of ingredients.
Doctor, I read there are different types of flu shot vaccines. Could you please help me understand the differences?
Sure. The most common type is what we call quadrivalent, because it has 4 strains of flu that are built in, and that's the most common one you'll see. But then now there's also other types that are specifically ones for folks who are 65 years of age and older. One is a higher dose. In other words, have more of the vaccine, more of the dose of the vaccine in the shot. It's a high dose vaccine. And the second one is one that has a protein inside that also is used to stimulate the immune system. So what we know is that in folks who are 65 and older, they sometimes don't have the most robust immune response. Their immune systems are a little bit different than younger folks. And so if you give a higher dose, they can provide a better response. Or if you add a protein to the vaccine, that can also boost the response. And then the other question folks ask is about egg allergies. People who really do have deathly allergies to eggs, which is pretty rare. They had a completely egg-free vaccine available as well. So there's different types. And, if you go to your pharmacist, your doctor, and discuss, your allergies or your other medical conditions, they can guide you for the right type of flu shot for you.
Can kids have a flu shot, or from which age do you start applying that?
Yes, good. Also, good question. The kids can get the flu shot after age 6 months. So
wow.
Pretty much, aside from newborns, essentially, most pediatricians recommend it. Well, all pediatricians recommend it after 6 months, and it's set on the schedule usually with the rest of the vaccines that the kids are due for.
That's good to know, because my niece, once she started the school, she's 3 years old, she was sick all the time because everybody was sick around her, so she got sick all the time. And I'm trying to convince my sister to talk to the doctor to see if we can do something when they come back to school, because it's a nightmare for the kid and for the parents as well. They don't sleep.
Absolutely. I think it's important to get all childhood vaccinations, and along that includes a yearly flu shot, and all pediatricians have them at their offices. This year's flu shot is available everywhere at this point. So definitely, even with your kids, take them in. And like you said, otherwise it's going to be miserable for you if they get the flu, because they get very sick as well.
Doctor, I've seen places and different pharmacies with UHealth there, like little kiosks that you can. Yes. Can you get the flu shot there, or you have to go to the main building? Where can we have it?
Absolutely. There's several different places you can go. First of all, you can go to any of your regular doctor's clinics. All of the primary care clinics and many of the other clinics that UHealth all have a flu shot. You can also, like you mentioned, go to the UHealth clinics that are within Walgreens. So we've partnered with Walgreens, and we have a number of clinics with them, and you can just walk in and do a walk-in visit essentially and get the flu shot. So there's plenty of opportunities to get the vaccine, and certainly we have 140 something clinics in UHealth, so any of those will be fine as well. Is
it covered by insurance, or because I've seen that they're doing like now with the COVID-19 like flu shots for free, basically?
Yeah, exactly. Most insurance companies cover it, and so it's pretty easy. I mean, I think some folks even provide incentives from a public health perspective to get the flu shot. Like I think Publix gives a gift card and things like that. So it's relatively inexpensive, and so it's covered by most insurance companies. Absolutely.
Let me tell you a secret, doctor, that is not going to be a secret once we publish this. I once got the flu shot, and I felt, like you said, kind of like the symptoms of a flu, mild flu. I didn't like the feeling, but I didn't get sick throughout the whole year. So I was like, I need to remember to do it again. And I never, it's crazy, but another year passed and another year passed, and I always forget to do it. But this year, since COVID-19 happened, then I have elder parents, I have my niece with us. So we're like a big family. I told my parents and everybody, you know what, we're getting the flu shots because we can get the risk to have now a regular flu and it's like too much stress for me.
So two important points is certainly you don't want to get both viruses at the same time, and it has been reported. We were kind of at the end of winter when we got COVID here in the United States, especially in South Florida, and so there weren't that many cases, but we did have them. So co-infection can happen. The second thing to remember is that the last time there was such a big pandemic in the in the world really, was in 1918, the Spanish flu. So many people remember. So the last big pandemic in the world that killed around, estimated 20 to 30 million people around the world was a flu virus. It was not a coronavirus. And so this virus has the same potential to become a pandemic. And so that's why it's so important to make sure we get vaccinated, because the last thing we want is another pandemic. I think, COVID has reminded all of us how terrible it is and how it affects all of our lives, not just, in terms of our loved ones, but even our day-to-day, how we work and everything. So I think it's a really good reminder to the Spanish flu and how it affected life then. And if you go on Google and look for pictures from the Spanish flu, you'll see it's very similar to times now. So flu has that same potential to make a pandemic, and we definitely don't want that again. So another reason to get the flu shot.
Thank you so much, Doctor, for all your help and information. As I always say here at chickenall.com, I always interview you guys, the doctors, because I want to have your expertise and have the facts, because
Yes.
Dr. Google is not helpful. So we need experts to know about it. So thank you so much. I will be sharing this everywhere. Please, if you have questions, you can leave the questions here, but you can always make your appointment at U Miami Health or as U Miami in all the Walgreens, or where you can get the flu shot now. When is the period to have it, doctor? Right now?
Right now, absolutely.
Okay.
It started. We already started vaccinating all of our employees as well. So it's been probably about 3 weeks. So go get your flu shot.
Okay. Thank you so much, doctor, for your time.
Thank you. And thank you so much for having me.
Thank you. Bye-bye.
Bye.